What's the deal with rib cartilage fractures? Justin Herbert and Alvin Kamara with this injury. This is Dr. David Chao, Sports Injury Central Pro Football Doc. Ribs can be broken, and that usually is bone, but in front, in the lower part of your rib cage, is rib cartilage. They can be subluxed, dislocated, and shift, or they also can be cracked. This is both good and bad news. Of course, Alvin Kamara missed week 2 because of the rib cartilage fracture. The question now is how much time and will Justin Herbert miss? Rib cartilage injuries, the good news, no lung involvement. That's good news. The good news, probably a little less pain acutely than with a rib fracture. The bad news, because of lack of blood supply and blood flow, takes longer to heal. Think of it this way. If you cut yourself shaving or bite your tongue, it bleeds a lot but heals very quickly. If you get a paper cut on your hand, it takes a long time to heal because of lack of blood and bleeding. That's the difference here with the rib cartilage injury. So what's going to happen? Alvin Kamara, it's not a matter of toughness. It's very painful. A flak jacket for Justin Herbert isn't going to do it. It's not about the contact. It's about the twisting that you have to do to play the game of football, to throw a ball for Justin Herbert, to a stretch play run and a handoff. It's not just about being hit and protected with the flak jacket. There's really no good or easy way to play without a rib intercostal nerve block. Alvin Kamara obviously couldn't play, didn't play. Maybe his rib cartilage fractures are more severe. Rib cartilage fractures are trickier to inject, or maybe it's also his right to choose not to, or the team decided not to. Now, even if you get through a game, once the numbing wears off, it's pretty painful the next day. So Justin Herbert, he's going to miss practice. He could be limited, but there's no way he's full practice. It's either DNP or limited practice, and that may be for weeks because of the rib cartilage injury. In order to play, he'll need a game day injection, which I believe he will take. This kid wants to play badly, so this is why I don't think he'll miss time. Of course, Adam Schefter reported that, and this lawsuit against the current Chargers team physician has been out there for over a year from Tyrod Taylor. The irony is Tyrod Taylor's lung issue from a rib block injection started Justin Herbert's career in week 2 of Herbert's rookie season. And now things have come full circle. Hopefully Herbert can play through for the Chargers. Hopefully Kamara will be back soon. But both of them will be dealing with this injury well into October. When they play and how they play really depends on the rib block injections in the time being. Fairly standard. I had my assistant count, and across my almost 2 decades, we probably did close to 100 of them. Philip Rivers has allowed me to talk about it as a quarterback, different rib fractures and rib cartilage injuries, multiple occasions throughout his career, multiple weeks of rib block injections. It can be done safely, and most people didn't even know about Rivers and his rib injuries when that was all going on. In any case, hopefully these 2 stars will be going and playing in week 3, and they'll need the doctor's help to do so. This is Dr. David Chao, ProFootballDoc, SICScore.com. Thanks for watching.